Cardiopulmonary resuscitation. Cardiopulmonary resuscitation is a life-saving technique. It aims to keep blood and oxygen flowing through the body when a person's heart and breathing have stopped. CPR is for people experiencing with cardiac arrest. Now, second, want to seek help in an emergency. In an emergency situation, someone's health can deteriorate quickly. Always seek help for any of these life-threatening signs. First, severe bleeding. Second, difficulty breathing, not breathing, unconsciousness, born serious accidents or trauma. Just call 000 for an ambulance in an emergency to get medical assistance. Then, when is CPR needed? CPR is most successful when administered as soon as possible. CPR is required when a person is unconscious, not breathing normally, not breathing, a person in cardiac arrest that will grab a snorter, take gasping breaths. This is not a normal breathing. Now let's proceed to the procedure.
First, you're going to check for the danger. Check for the danger signs and ensure the patient's safety. So you are going to check for the environment of the patient or the casualty. So check if there is any stone or other equipment in the patient's environment. Then afterwards, you're going to check for the response. By checking the response, you are going to have the person appears unresponsive. Then check for the responsiveness to breathing, the life-threatening bleeding or other life-threatening conditions using the method of shout, tap, shout. Check for the patient if she can hear you. So you are going to tap the patient's shoulder. Mom, can you hear me? Mom, what is your name? Then afterwards, you are going to squeeze your hands on send response if there's any. Just squeeze your hands, mom. So the patient doesn't respond. For the person, if she responds and is not breathing, so only gasping, just call 911 and then the equipment or tell someone to do so. Excuse me, can you call the 911 in order since there is a casualty in the area? After that, you are going to open the airway. If there's no 911 coming, then check the mouth for any blockages. So you're going to open the airway. Then afterwards, you are going to check for the breathing of the patient. By checking the breathing, you are going to look, listen, and then feel. So looking for the rise and fall of the chest movement, and then afterwards, you are going to listen, then at the same time, feel the movement of the air from the nose of the patient. So by doing this procedure, you are going to check for the breathing of the patient. Then the patient does have any breathing. Then afterwards, you are going to start for the CPR procedure. So we have the 30 chest compression and then 2 breaths with a dip of at least 2 inches with a rate of 100 to 120 per minute, and then allow chest return to the normal position after each compression. So by that, you are going to use stimulatory time, which stands for the 1001 up to the 1030. So by that, you are going to place your 2 hands with interlock on the patient's chest area. So make sure that your shoulder is in the straight position. 1001. Then afterwards, you are going to open the airway to pass the neutral position using the head tilt chin lift technique. So ensure that the breath lasts for about 1 second. Then after that, you are going to check for the rise of the chest area and then allow for the exit before giving the next breath. So you are going to have the pinch the nose of the patient and then tilt the chin part. For the next procedure, continue give setting of 30 chest compression and then we have the 2 breaths. So after that, you are going to continue the procedure. Then you are going to attach the defibrillator if there's any. So by using the AED as soon as possible if the patient doesn't have a breathing. That's all. Thank you.